Here's something many people don't realize. Hydrocephalus affects millions worldwide, from unborn babies to older adults, and its prevalence is increasing with aging populations. Globally, about 85 people per 100,000 have hydrocephalus, with rates higher in children, the elderly, and regions like Africa. Think about that for a moment. This condition can affect infants, young adults, and seniors, yet it is often overlooked, misdiagnosed, or misunderstood. That lack of awareness can delay treatment, and in hydrocephalus, delays can be life-changing, with untreated cases carrying high risks of developmental delays, cognitive decline, mobility issues, and even death. That's why today, on September 20th, on World Hydrocephalus Day, we're joining voices across the globe to raise awareness, fight stigma, and stand with patients and families living with hydrocephalus. Welcome to Study Neuro, your hub for practical insights into brain and nervous system health. In this special awareness video, we'll explore what hydrocephalus is, what causes it, why awareness matters, and most importantly, how together we can bring hope and support to those affected. What is hydrocephalus? Hydrocephalus is a medical term that literally translates to water on the brain. But that phrase can be a little misleading because it's not actually water. What builds up is something called cerebrospinal fluid, or CSF. Now, CSF is a clear, protective fluid that flows in and around the brain and spinal cord. Under normal conditions, it acts like a cushion, protecting delicate brain tissue, delivering nutrients, and even clearing away waste. The brain constantly produces and reabsorbs this fluid in a carefully balanced cycle. But in hydrocephalus, that balance is disrupted. Too much CSF begins to accumulate inside the ventricles, the fluid-filled spaces deep within the brain where CSF is made and stored. As the fluid builds up, it increases the pressure inside the skull, stretches the brain tissue, and starts to interfere with normal brain function. The symptoms can look very different depending on age. In babies and young children, you may notice a rapidly enlarging head, bulging of the soft spot, irritability, or delayed development. In older children and adults, common signs include headaches, nausea, blurred or double vision, and sometimes problems with concentration or learning. In older adults, it may present in a more subtle way, with difficulties walking, memory problems, urinary incontinence, or changes in behavior, often mistaken for normal aging or dementia. The important thing to remember is this: hydrocephalus can occur at any age, from newborns to the elderly, and timely diagnosis and treatment are critical. When recognized early, treatment can relieve pressure, protect brain function, and truly change the course of someone's life. So, what exactly causes hydrocephalus? The truth is, there isn't just one single cause. Hydrocephalus can develop in a number of different ways. But in every case, it comes down to a problem with the normal cycle of cerebrospinal fluid. Either too much fluid is being produced, there's a blockage stopping it from flowing freely, or the body is struggling to reabsorb it back into the bloodstream. Let's break it down. Congenital hydrocephalus. This is when a baby is born with the condition. It can be due to abnormal development of the brain before birth, or related to conditions like spina bifida, where the spinal cord doesn't form properly. These children may show signs very early in life, sometimes even before they're born on prenatal scans. Acquired hydrocephalus. This develops later and can happen at any age. Some common causes include infections like meningitis, which can damage the delicate pathways of CSF, brain tumors, which can block fluid flow, bleeding inside the brain, especially after a stroke or in premature babies, or head injuries, which can disrupt the normal balance of CSF. Normal pressure hydrocephalus, or NPH. This is most often seen in older adults. Despite the name, the pressure inside the brain can still be harmful. NPH is often linked with changes in aging or damage to the brain's ability to absorb fluid. It typically causes a classic triad of symptoms: difficulty walking, memory problems, and urinary incontinence. Sadly, it's often mistaken for dementia or Parkinson's disease, which is why awareness is so important. So, whether it's something you're born with, something that happens later due to injury or illness, or something that develops with age, the root issue is the same: too much fluid where it shouldn't be, putting pressure on the brain. Now, you might wonder, can hydrocephalus actually be prevented? The honest answer is not always. In cases of congenital hydrocephalus, when a baby is born with the condition due to brain malformations or developmental problems, prevention is usually not possible. But when it comes to acquired hydrocephalus, there are definitely steps that can lower risk and protect brain health. Here are a few key ways. Prevent and treat infections early. Illnesses like meningitis can damage the brain's delicate fluid pathways. Vaccinations, proper hygiene, and seeking medical care quickly when infection is suspected are powerful ways to reduce this risk. Safe pregnancy and childbirth practices. Hydrocephalus in newborns can sometimes follow brain bleeds during complicated births. Access to skilled prenatal care, safe delivery environments, and good maternal health can make a real difference. Prevent head injuries. Trauma is another important cause. Simple precautions like wearing helmets while biking or riding motorcycles, using seatbelts in cars, and following workplace and sports safety rules can go a long way in protecting against brain injury. And seek early medical attention. Conditions like brain bleeds, strokes, or tumors don't always lead to hydrocephalus, but if left untreated, they can. Paying attention to new or worrying symptoms like severe headaches, sudden confusion, or difficulty walking and getting checked early can help prevent complications. So while it's true that not every case of hydrocephalus can be avoided, these practical steps can reduce the risks and support overall brain health. And, just as importantly, they remind us that prevention isn't only about individuals, it's about strong health systems, community awareness, and making safety a priority in everyday life. Hydrocephalus can lead to some problems. Sometimes the shunt may block, get infected, or stop working. This can bring symptoms back quickly. In children, hydrocephalus can slow down learning, behavior, and growth if it is not treated early. In adults, it can cause memory loss, poor focus, and trouble with daily activities. Some people may find it hard to walk, lose their balance, or fall often, especially older adults with normal pressure hydrocephalus. It can also affect emotions. Patients and families may feel stress, worry, or stigma because of hospital visits and uncertainty. But here is the good news. With quick diagnosis, good follow-up, and strong support, many of these problems can be prevented or managed well. The good news is that hydrocephalus is treatable. Modern medicine has made enormous strides in helping patients live longer, healthier lives. The most common treatment is surgery to divert the fluid. The shunt system, a thin, flexible tube that drains the excess cerebrospinal fluid from the brain into another part of the body, usually the abdomen, where it can be absorbed. Shunts have been used for decades, and while they require monitoring and sometimes revisions, they remain the backbone of hydrocephalus care. Endoscopic third ventriculostomy, or ETV, is a minimally invasive procedure available for certain patients. Instead of placing a shunt, surgeons create a new pathway for the fluid to flow inside the brain, reducing dependence on hardware. Both treatments can be life-saving and life-changing, giving patients the chance to grow, learn, work, and live full, meaningful lives. But it's important to understand treatment is not the end of the journey. Hydrocephalus is a chronic condition, and families often face ongoing challenges. Regular medical follow-up, because shunts can block, break, or become infected. Recognizing signs of shunt malfunction quickly, like severe headache, vomiting, drowsiness, or personality changes, is critical. Physical and rehabilitation needs. Some children and adults may require physical therapy, occupational therapy, or speech therapy to maximize independence and recovery. And emotional and social impacts. Living with a chronic condition can bring anxiety, stigma, or isolation. Patients and caregivers alike may need counseling, school or workplace accommodations, and strong community support. So while surgery provides hope and relief, the true success story of hydrocephalus treatment lies in ongoing care, awareness, and support systems that surround each patient and family. Hydrocephalus is more than just a medical condition. It is a life journey. For many children and adults, that journey can feel heavy, but together we can help make it lighter. Hope begins with awareness. When we share knowledge, families can recognize the signs earlier, seek treatment faster, and make informed choices. Awareness saves lives. Support grows in community. No one should walk this path alone. By listening, by showing compassion, and by speaking openly, we help break the silence and fight the stigma around hydrocephalus. Everyone has a role to play. Families bring courage by sharing their stories. Friends bring comfort by standing beside loved ones. Doctors and nurses bring healing with both skill and empathy. Communities bring strength by supporting research, advocacy, and better care. When we join hands, awareness turns into action. Action turns into hope. And hope builds a brighter future. A future where every person living with hydrocephalus is understood, supported, and given the chance to thrive. Together, we are not just raising awareness. We are raising hope. World Hydrocephalus Day is more than just a date on the calendar. It's a reminder of three powerful truths. 1. Awareness saves lives. Far too many people don't recognize the early warning signs, like a baby's rapidly enlarging head, a child's persistent headaches, or an older adult's sudden changes in balance or memory. These red flags are often mistaken for normal growing pains or simply aging. The result? Delays in diagnosis that can cause permanent damage or even cost lives. By spreading awareness, we empower families and healthcare workers to act quickly, turning potential tragedy into hope. 2. Patients and families need support. Living with hydrocephalus isn't just about surgery, it's about daily resilience. Parents may spend sleepless nights watching for signs of shunt malfunction. Children may need extra help in school. Adults might face stigma or workplace challenges. Caregivers often juggle medical appointments, financial strain, and emotional stress. They deserve not only medical care, but also compassion, community, and resources that remind them they're not alone on this journey. 3. Research changes the future. Even though hydrocephalus has been recognized for centuries, there's still so much we don't know. Why does it occur in some people and not others? How can we reduce complications from shunts? Could new therapies one day replace surgery altogether? The answers lie in continued investment in science and innovation. Supporting research means better treatments, fewer complications, and improved quality of life for future generations. So today, on World Hydrocephalus Day, we remember awareness, support, and research are not luxuries, they are lifelines. And each of us has a role to play in making them stronger. Today, let's stand shoulder to shoulder with patients, families, and caregivers living with hydrocephalus every day. Their courage is extraordinary, but they cannot face this journey alone. Share this video. Every share could be the moment someone recognizes the signs of hydrocephalus and seeks help early. Support hydrocephalus foundations locally or globally through donations, volunteering, or simply amplifying their voices. You can help provide life-saving surgeries, essential resources, and a supportive community. Act promptly on symptoms. If you or someone you know experiences persistent headaches, unexplained balance issues, memory changes, or in babies, an enlarging head, don't wait. Seek medical attention immediately. Early intervention saves lives. Together, we can turn awareness into action, replace stigma with understanding, isolation with community, and fear with hope. Thank you for joining us on World Hydrocephalus Day.